This is the last in our series of discussions, and we're going to be looking very briefly about where you might go to get some help for your migraine. Of course, there's a lot of information out there on the internet, but just because it's on the internet doesn't mean to say it's high quality information. Alison, where do you normally direct your patients to look for further information?
We would normally say be very selective about what you read on the internet, and we recommend looking at the Migraine Trust website or the Migraine Action website, where they've got lots of good quality information for help with migraine, fact sheets, information about where migraine clinics exist, also education days, so it's high quality information that's reliable.
Right, so these are the two UK-based organisations?
These are the two UK-based organisations.
Yes. Well, we talked a little bit about how people can help themselves, and there's quite a lot of things people can do. They can get aspirin, they can get domperidone. We've said they can buy a triptan from their chemist, and the pharmacist will in fact give you quite a lot of help and support with your migraines. But I think it's important to stress that if your migraines are bothering you, you must go and see your GP sooner rather than later. So what sort of things could you do to help your GP? Well, the GP is only 10 minutes, and that's a very small amount of time to deal with a headache problem. I have the luxury of 45 minutes in my clinic, and I find it very difficult in just 10 minutes to try and sort someone's headache out. So the more you can do to help your GP, the better it's going to be. And we've found that if your GP recognises or understands the impact of your migraine, he'll deal with the migraine far more effectively. So don't be frightened to say to your GP what impact your migraine has on the quality of your life. I think it's also quite important to bring along a diary of the last couple of months, 2 or 3 months. You can see if you're a woman, if there's any menstrual relationship, and your GP can get some sort of idea about how frequent and how long your headaches are lasting for. And I think it's important to give your GP a clear idea of what medications you've tried and how often you're taking medication. We've talked about medication overuse headache, and if you're taking medication frequently, that may be another area your GP wants to explore. So what do you do if you don't get satisfactory treatment, if things don't move forward? Well, you can ask your GP to get referred onwards. Now, unfortunately, despite the huge frequency of migraine in the UK, there are very few migraine clinics, but the Migraine Patients Organisation can suggest to you where your local clinic might be. You can get referred to the local neurologist, but it's quite difficult to find a neurologist that has a specific interest in headache, and it's better if you can to be referred to a specific headache clinic. So I guess that pretty much finishes our series of discussions. I hope you found them useful. I'd like to thank Anne and Alison for being with us here today, and hopefully following this series of videos you'll have a little bit better understanding about your migraine and be able to treat it a little bit more effectively.